Bismillahirrahmanirrahim. Rabbi Zidni Ilma. Quote of the day. Life isn't about finding yourself. Life is about creating yourself. Assalamu alaikum everyone. My name is Dr. Sadir Feek and under the supervision of Professor Dr. Saira Afzal. Today my topic of presentation is infant and child mortality. Learning outlets includes introduction about infant mortality rate and under 5 mortality rate, its causes, preventive strategies, key findings by WHO and UNICEF, recent updates and multiple choice questions. Learning outcome. At the end of this presentation, participants would be able to describe infant and child mortality in detail, WHO recommendations, and recent updates. Introduction. Infant mortality is the probability of dying before the first birthday, whereas child mortality is the probability of dying between the first and the fifth birthday. If we see mortality in and around infancy, you can see if we say it's a 8 weeks of gestation, it means mother is pregnant. It starts from this till birth. If any death occurs, it is known as stillbirth because mother was pregnant. But if it occurs after the birth, like 7 days after the birth, it is called perinatal death. So basically we have stillbirths and early neonatal deaths and perinatal deaths. Second come from birth to 28 days is called the neonatal period. It is further subdivided into first 7 days, which is early neonatal death, and the late neonatal death. And if we see, it's the post neonatal death, which is starts from 28 days after the delivery till the first year. So infant mortality includes all these things after birth. It is one of the important diagram, you can remember it. Now starting, infant mortality rate is the mortality rate, the number of infant deaths per every 1,000 live births. It gives key information about maternal and infant health and also is an important marker of the overall health of the society. By definition, it is the number of resident newborns in a specified geographic area, which is country, state, dying under 1 year of age divided by the number of resident live births of the same geographic area multiplied by 1,000. You can see number of resident infant deaths to live births multiplied by 1,000. And I found it a very good sort of a picture to remember. It refers the number of deaths of infants under 1 year old per 1,000 live births. Causes of infant mortality. Now I'm talking about neonatal mortality which is from birth to 4 weeks. It includes a low birth weight and prematurity, birth injury and difficult labor, sepsis, congenital anomalies, hemolytic disease of newborn, placental cord anomaly, diarrhea, acute respiratory tract infections, and tetanus. As far as postnatal mortality, which is from first month to 12 months, the causes mainly are diarrheal diseases, acute respiratory infections, other communicable diseases, malnutrition, congenital anomalies, and accidents. If we see the 10 countries with the highest infant mortality rate by UNICEF 2020 per 1,000 live birth, on the top of the list is Sierra Leone, which has 80. Then the Central African Republic, which has 77.50, then Somalia 72.72, Nigeria, and the list goes on. At the end, it is Mali, which is 58.77. Infant mortality rate for Pakistan is 58.46 deaths per 1,000 live births in 2020. And it was in 1971, it gradually fell to, it was initially 139.87. And now it is improving. And by 2020, it is 58.46 deaths per 1,000 live births. So this is, you can see, this is the number and this is the years infant mortality rate, and it is by 2020, it is declining. Same over here, you can see by this, it was like 2009, it is 70, then it is declining, then in 2014, it's 67.8, and in 2020, it is around 54.2. It is again the data given of the infant mortality rate for 1950 to 22. And you can see it is 56.8, and it is Alhamdulillah, gradually decreasing. In 2021, it is 56.88. In 20, it is 57.919, 59, and it was in 18, it was 60. So it is declining. Again, the diagram you can see by the graph, it is falling down gradually. So the current infant mortality rate of the world in 2022 is 26.69 deaths per 1,000 live births. And there's also a decline from 2021, and it is in 2021 it was 27.334, and now it is 26.693. So there's decline of 2.35% from the previous year. Again, if we see this graph, these are the years and this is number. It is infant mortality rate by region. Of the world is the navy blue. You can see it is declining, and green is shown of the Asia. So it started like this and it is declining, and it's hopefully by 2040 to 2045 it will be still lower. According to CDC, infant mortality rate and its causes, main causes, five leading causes in 2020 in the United States were birth defects, preterm birth or low birth weight, sudden infant death syndrome, injuries including suffocation, and the maternal pregnancy complication. Now talking about child mortality. Child mortality or the under 5 mortality rate refers to the probability of a child dying between birth and exactly 5 years of age, expressed per 1,000 live births. Types of child mortality. Perinatal mortality rate is the number of child deaths within first week of birth divided by total number of births. I have told you perinatal mortality includes stillbirths, 28 weeks of the gestation till the of 1 week after the birth. Then the neonatal mortality rate is a number of child deaths within first 28 days of life divided by total number of births. Infancy mortality rate is the number of child deaths within first 12 months of life divided by total number of births. Then the under 5 mortality rate, which is the number of child deaths within fifth birthday divided by total number of births. Pakistan under 5 mortality rate is now 65.2. And you can see like infant mortality rate, this child mortality rate is also declining in Pakistan. Again, you can see these are the dates, and it was the value in 2021, changes also, it is decreasing, but it's very slowly on the decline. The leading causes of death of children under 5 include the preterm birth complications, pneumonia, antepartum related events, neonatal sepsis, diarrhea, malaria, malnutrition. You can see a huge figure, 34% due to malnutrition. Again, this is the diagram you can see. Different causes, 37% neonatal causes, then the HIV, diarrhea, measles, malaria, pneumonia, injuries, others. And the causes of neonatal death include different tetanus, diarrhea, sepsis, is asphyxia, congenital or preterm deaths. Again, deaths among children under 5 years of age, you can see the leading causes are the pneumonia, diarrhea, injuries, neonatal causes, and others. And the top 5 countries are the India, Nigeria, Pakistan, Congo, and China. According to Pakistan demographic health and infant mortality rates, it's right now it's 54 and under 5 is 65. So under 5 mortality rate is 25.2 per 1,000 live births. Challenges in Pakistan. Millions of young lives could be saved every year if mothers and babies had access to affordable, quality healthcare, good nutrition, and clean water. 75% of newborn deaths are caused by 3 preventable and treatable conditions, which includes a complication due to premature birth, complications during labor and delivery, infections such as sepsis, meningitis, and pneumonia. Regional variations in under 5 mortality rate according to PDHS. Child mortality is highest in Punjab, where neonatal infant under 5 mortality rate 51, 73, and 85 deaths per 1,000 life birth respectively, and the lowest rates are in FATA with 18, 19, 33 deaths per 1,000 life births respectively. Preventive and social measures. Number one is the prenatal nutrition. It includes to improve maternal nutrition. And the mother is pregnant, she should have additional 500 kilocalories and 10 grams proteins throughout her pregnancy. And there should be food supplementation programs as well. Next comes the prevention of infection by the certain immunization. Then the breastfeeding. Protect, promote, and support breastfeeding practices. Growth monitoring is very important and identify the children at risk of malnutrition. Then the family planning, sanitation, primary health care, detection of high-risk mothers. Then there should be a proper referral services. Then the socioeconomic development includes a provision of safe water, improved basic sanitation, female literacy, housing conditions, growth of agriculture and industry. The leading causes of death during the postnatal periods are diarrhea 27% and pneumonia 26%. An increase in the birth interval from 2 to 4 years or more result in better neonatal and child survival by 2.4 times in neonate and 2.9 times in children under 5 years. So increase in women education, decrease in infant mortality. So major contributors to under 5 mortality, 27% prematurity, 24% asphyxia, 34% sepsis, and 10% congenital anomalies. Key facts by WHO about newborn deaths. Although the global number of newborn deaths declined, but children still face the greatest risk of death in their first 28 days, which means neonatal deaths. Children who die within the first 28 days of birth suffer from conditions and diseases associated with the lack of quality care at birth or skilled care and treatment immediately after birth and the first few days of life. Preterm birth, intrapartum related complications, including birth asphyxia, infections, and birth defect cause most neonatal deaths. Women who receive midwife-led continuity of care provided by professional midwives, educated and regulated to international standards, are 16% less likely to lose their baby and 24% less likely to experience preterm birth, and it is a huge number. Causes of infant and child mortality by WHO. The majority of all neonatal deaths, which is 75%, occur during the first week of life. So you can imagine how important is the birth period, delivery, and the first week of life. Preterm birth, intrapartum related complication, birth asphyxia, lack of breathing at birth, infections, and birth defect causes most neonatal death. But from the end of neonatal period and through the first 5 years of age, the main causes of death are pneumonia, diarrhea, birth defects, and malaria. Malnutrition is an underlying contributing factor, making children more vulnerable to severe diseases. So priority strategies advised by WHO, number one is essential newborn care. All babies should receive the following. Thermal protection, which includes promoting skin-to-skin contact between mother and infant. Hygienic umbilical cord and skin care. Early and exclusive breastfeeding. Assessment for the sign of serious health problems or need of additional care. For example, those that are low birth weight, sick, or have an HIV-infected mothers. Then the preventive treatments include immunization, BCG, hepatitis B, vitamin K, and ocular prophylaxis. Number two, the families should be advised to seek prompt medical care if necessary. Danger signs including feeding problem or if the newborn has reduced activity, difficult breathing, fever, fits, conversion, or feed cold. The birth should be registered and bring the baby for timely vaccination according to national schedules. Priority strategies by WHO for low birth weight and preterm babies include: if a low birth weight newborn is identified at home, the family should be helped in locating a hospital or facility to take care for the baby. Increase attention to keep the newborn warm, including skin-to-skin care, assistance with the initiation of breastfeeding, extra attention to hygiene, especially hand washing, extra attention to danger signs and the need for care, and additional support for breastfeeding and monitoring growth. Sick newborns, danger signs should be identified as soon as possible in health facilities or at home, and the baby referred to the appropriate services for further diagnosis and care. Newborns of HIV-infected mothers, preventive antiretroviral treatment for mothers and newborns to prevent opportunistic infections. HIV testing and care for exposed infants, and counseling and support to mother for infant feeding. If we see the Sustainable Development Goal, SDG 3.2, by 2030, and preventable deaths of newborn and children under 5 years of age, with all countries aiming to reduce neonatal mortality rate at least as low as 12 per 1,000 live births and under 5 mortality to at least as low as 25 per 1,000 live births. So the things to remember is 12 in infant and 25 for under 5. Together, we must strengthen and invest in care during pregnancy, labor, birth, first day, week, year, or lifelong continuum of care approach. Improve quality of maternal, newborn, child, and adolescent care. Reach every mother, newborn, and child to reduce inequities. Harness the power of parents, families, and communities. Count every mother, newborn, child, and adolescent through measurement, program tracking, and accountability. Now talking about the recent updates. One of the article in the Lancet about the parental education and inequalities in child mortality, a global systematic review and meta-analysis. And the results showed that lower maternal and paternal education are both risk factors for child mortality, even after controlling for other markers of socioeconomic status. The study provides robust evidence for universal quality education as a mechanism to achieve the Sustainable Development Goals 3.2 of reducing neonatal and child mortality. So again, the effect of adolescent pregnancy or child mortality in 46 low and middle income countries. And it shows that adolescent motherhood is associated with dramatically worse child survival, likely reflecting a combination of biological and social factors. And it was one of the socioeconomic determinants of child mortality in Pakistan and the moderating role of household wealth index. In this Pakistan Demographic Health Survey 2017 to 18 was used, and the result indicate that the likelihood of child mortality decreases with an increase in women education, their empowerment, their husband's education, their wealth status of their household, access to clean drinking water, access to toilet facilities, and exposure to mass media. National Health Plan 2016 to 15 to address challenges of reproductive, maternal, newborn, child, adolescent health and nutrition. And in the National Plan, there's every newborn impact framework, which shows the impact of every woman, every newborn, every child. And it has input, outputs, and the outcome. Quality care, count every woman, newborn, leadership, governance, all this combination, teamwork, liaison with each other will lead to this impact. Ending preventable diseases for women, stillbirths, newborn children, improving child development and human capital. So Every Woman, Every Child by UNICEF. The Global Every Newborn Action Plan, launched in 2014, provides a roadmap of strategic action for ending preventable newborn mortality and stillbirth and contributing to reducing maternal mortality and morbidity. So the ending preventable newborn deaths, every year 2.6 million babies die in the first 28 days of life, most of the first week. And the top causes are prematurity, complications during birth, and severe infections. And an additional 2.6 million stillbirths occur each year because 50% after labor has begun. But 75% of newborn deaths can be prevented by high quality care. So healthy mother plus healthy birth plus good health in first days of life leads to the start of the healthy childhood. There's a launch of Every Newborn Action 2025. This action will not determine the cause of maternal newborn health for the next decade and the health and lives of future generation. Essential healthcare services, including high quality maternal newborn healthcare, must be sustained and further strengthened to withstand shocks like COVID-19 in order to protect the lives and health of the women and children and make progress towards the SDGs. So moving faster to end preventable newborn deaths and stillbirth by 2030. 2025 coverage targets and milestones. So pending by 2030. And it is done provides a roadmap to end preventable newborn mortality, reduce disability, and preventable still by 2030 to guide countries in reaching their targets. Multi-party initiative team, co-chaired by UNICEF and WHO, reviewed and updated coverage targets and milestones to guide progress between 2020 and 25. The documents also sets out new global, national, and subnational targets and action plans that can be taken in partnership to accelerate progress. These are my references. Now it's time for MCQs. Pakistan is one of the most populous countries in the world and had perinatal mortality rate of 60 to 90 per thousand births. Perinatal mortality includes all deaths. Options are infants, neonates, early and late, only early neonates, late neonates and stillbirths, early neonates and stillbirths. The correct option is E, early neonates and stillbirths. A researcher wants to know the health status of a community level of living and effective net of MCH services in a region. Which indicator is the most appropriate for this purpose? Neonatal mortality rate, infant mortality rate, under 5 mortality rate, postnatal mortality rate.
Under 5.
C.
B, infant mortality rate. Health indicators play a very important role in any country. The best indicator to assess the socioeconomic development in a country is infant mortality rate, neonatal mortality rate, under 5 mortality rate, and postnatal mortality rate.
Under 5.
And under 5 mortality, yes, it is the best indicator to assess the socioeconomic development. Which of the following rates is labeled as the best predictor of the state failure? Infant mortality rate, neonatal mortality rate, under 5 mortality rate, and postnatal mortality rate.
A, infant mortality rate.
Yes, infant mortality rate is the rate because it tells us about the overall health of the society, including mother and child. Birth weight plays very important role in the newborn. Which range of the birth weight is considered as a risk factor in infant mortality? Different options: less than 2.5, more than 4.5 kg, birth weight less than 3 point or more than 4, less than 2.8, more than 4.5, or birth weight less than 2.5 and more than 4 kgs.
A.
No,
A.
D is the correct answer because this is the weight which is at high risk. Sorry, you are right. A is the correct answer because it is the weight which the birth weight below 2,500 grams and more than 4.5 kg is at high risk. A public health team wanted to start a public program in XYZ community where they found that 75% population is almost mother and child below the age of 15 years. There's also high birth rate of newborn, increased prevalence of low birth weight babies, and high maternal and perinatal mortality for last few years. Which health program must be given top priority in health program development in this community? Health insurance program, community mental health program, school mental health program, universal immunization program, reproductive and child health program.
E.
Yes, E is the correct answer, reproductive and child health program. In the XYZ community, a public health team found an increase in the prevalence of under 5 mortality rate, neonatal deaths, low birth weight babies, puerperal sepsis, and high maternal mortality, which is the MCH most common cause of MCH problem in this scenario. Poor health, service delivery, lack of evidence-based intervention, malnutrition, infection, and uncontrolled reproduction, or low female literacy.
C.
Yes, C is the correct answer. By 2030, the preventable deaths of newborn and children under 5 years in all countries. It is SDG 3.2. It aims at, these are the different options in front of you. Which one is the correct?
C.
Yes, absolutely right. To low 12 per 1,000 live births and 25 per 1,000 live births. Correct. Millions of young lives could be saved every year if mothers and babies has access to affordable quality healthcare, good nutrition, and clean water. Preventable and treatable conditions causing 2/3 of neonatal deaths includes options are in. A is the correct answer. Complication due to premature birth, complications during labor and delivery, and infections such as sepsis, meningitis, and pneumonia. These are the main complications. So A is the correct answer. According to about every newborn action plan and preventable stillbirths and newborn deaths by 2023, 25, 28, 2030.
2030.
Yes, the correct answer is 2030. This is my key and thank you so much.
Thank you very much, Dr. Sadia. Very nice presentation, very colorful, attractive, as well as very important topic that has been covered today. The MCQ's overall quality was very good, but I would like to comment on certain